All right, I'm going to go ahead and demonstrate NG tube insertion. First, I'm going to provide hand hygiene. I'm going to go to my patient's room and I'm going to do a focused abdominal and respiratory assessment. Want to make sure I'm listening to all the lung fields and all the areas of the bowel. Ms. Cook, I'm just going to take a second to listen to your lungs and listen to your abdomen as well. Is that okay? All right. Just breathe normally. Okay, listen to your abdomen. Yeah, I do not hear the sound in the upper left quadrant there. I'm also going to go ahead and do a set of vital signs. So I'm going to check your pulse ox, respiratory status, your blood pressure, your heart rate, temperature, all the things. Okay, so now that we have your vitals and your assessment done, I want to talk to you about the procedure that the doctor has ordered. Because you have this bowel obstruction, we want to do what's called decompression of the bowel. We're going to actually insert an NG tube, which I will show you what it looks like. So it is a stomach tube that's going to go into your nose. We'll look at your nostrils and see which one is patent. We'll measure it, make sure it's the correct length, and this is what it looks like. And then we'll hook it up to suction and hopefully give your bowel some rest to hopefully undo this blockage by itself. Do you have any history of any facial trauma or nasal trauma or brain surgery or deviated septum? No? Okay. Do you have any allergies to any medications, lubricant, gloves, latex? No? Okay. All right. Well, I'm going to go ahead and do hand hygiene, put my gloves on, and we'll go ahead and get started with this. I will also have someone come in and help me. We'll kind of walk you through it. So we're going to have you sit up. We're going to sit you up a little bit higher. Then we're going to start putting it into your nair. And then once we hit the back of your throat, I need you to kind of tuck your chin down and begin to swallow. We're going to have a cup of water for you, but we're also going to put a drape on you just in case we get any liquids on your chest. So just need some clean gloves. I'm going to go ahead and measure so I can put it in the appropriate length. Let's go ahead and look in your nairs, make sure we see which one is more patent. We can check a gag reflex as well, making sure that that's present. It looks like your right nair is more patent, so that's the one we're going to go down. So I'm going to go ahead and measure from the tip of the nose to the ear, and then we're going to go straight down to the xiphoid process. Okay, and I have you right at 50. So with that, I'm going to go ahead and mark it so I know when to stop. Got the rest of my supplies here. I got an irrigation tray, lubricant. This is my cup with water. And then in my irrigation tray, I do have the towel that we're going to put on our patient. So I'm going to go ahead and mark my tubing here. I can either mark it with a piece of tape or I can mark it with some permanent marker, just so I know when to stop advancing. All right, so I'm going to go ahead and put this towel on my patient. I have my assistant here to help me with the cup. I'm going to go ahead and lubricate my tube. This is not the most comfortable procedure for our patients, so just make sure you're paying attention to their cues and helping encourage them through this process. I'm going to go ahead and lube it really well. I'm also going to keep the basin just in case the patient gags and has some emesis. All right, are you ready, Ms. Cook? We're going to go ahead I'm also going to be watching her pulse ox the entire time because we want to make sure that the tube is going down into the stomach and not into the lungs. So if her O2 stat drops, then we know that it is in the lung instead of into the stomach. All right, we're going to go ahead and start advancing, okay? Once I hit the back of the throat, you're going to tuck your chin down. You're doing great, Ms. Cook. All right, go ahead and swallow. Keep going. You're doing so good. We're going to help you feel much better. All right, you did so good, Ms. Cook. All right, now we're going to go ahead and tape this. Secure this in the nose so that it doesn't come out. What we want to do with the tape, thank you for holding that, is we want to what we call pants the tape. So you're going to rip it just part way down so it looks like two little legs. You're going to go ahead and put this part on the nose and take the two tinier strips and just wrap it around the tube. Okay, so it's nice and secure. With this, you want to pin this or tape this to the patient's gown. And for her, it's going to be decompression, so we want to hook it up to suction. We'll hook it up to the canister, but we won't turn on the suction until it's verified via x-ray. So the only way we want this to be 100% verified is through x-ray only. After the x-ray has confirmed placement, then we can turn the suction on, and then after that, subsequent uses of this NG tube, we can use pull back, see if there's any gastric contents. So that will be with this guy here. If you just connect this to the tube like this and go ahead and pull back, then you can look at the gastric contents, and we'll check the pH and make sure that it is gastric contents. And then we also want to make sure the measurement stays the same. So if we're at 50, we're putting 50 centimeters on the chart. As far as the insertion goes, we want to make sure that that number stays at the nair. So as far as suction, to set up suction for an NG tube, we have our suction canister. We have the connector to the actual container in the mechanism here, but then to our patient, we have another tubing. So we're going to go ahead and hook up to our vacuum and hook it up to the port here. Put our suction in here, and it will tell you, it says vacuum and it says patient. So we connect the vacuum, which is this red, to the vacuum port, and then where it says patient, that's when we connect the tubing for the patient. So we can go ahead and connect it, just don't turn on the suction till it's been verified by x-ray. So that way, if we do get some backflow of stomach contents, it has some place to go. Okay, as far as documentation, I'm going to document the usage, which in this case would be decompression, the date, time, my initials that I put it in, the size French of the tubing, which is on the package. It'll tell you. So this one is a 16 French. Then we also want to put verification, so that will be via x-ray. The depth is 50 centimeters. Securement device was the tape. Site description, it looks good, it's in the right nair. Line status, currently it is not hooked up to anything yet until we have it verified. Once it's verified, we'll put to suction. And then if we